First, we're going to talk about chronic, or what I like to call persistent pain. I don't like the term chronic because I think it makes you feel like it's something that you're always going to have, whereas persistent makes you realize, okay, this is something that I have that is lasting longer than it should, but it's not something I'm necessarily doomed with the rest of my life. And so there's a lot of different causes with chronic pain. You may have been injured. It could have been from a car accident, a fall, numerous reasons. There's a lot of myofascial related causes, especially in the low back where your muscles are just tight and chronically tight is what you've been told. Fibromyalgia, a lot of different terms out there for this persistent pain that I like to call it. And so what we're going to do is go over some exercises that you can start doing at home. Now we have a mat, but you can certainly do them on the carpet. A little bit of padding is helpful just to help with blocking some of the bony parts of our pelvis and our shoulder blades as we're laying down. Okay, we're going to go over a few exercises. The first one is the pelvic tilt, and there's a lot of different terms for this. You may have heard of an imprint of your low back against the table or against the carpet. And what I'm going to have Darren do here is tighten up the abdominals and rock that pelvis back. And so it just has to be a subtle motion. And you'll see it's a common thing too to engage those hamstring muscles, which he's doing a little bit. Go ahead and relax a little bit there. Try to keep the legs relaxed as you're doing that, and just focus on the abdominals and let them be the primary movers there. And one of the main benefits of this exercise, I'll have you hold it for about 3 seconds and then relax, and then hold it for about 3 seconds. One of the main benefits is that you're getting control of those abdominal muscles. So there's a mind-body connection there that most people don't have naturally. And so as you get that muscle to turn on and shut off, you're actually improving that coordination, and those muscles in the back can start saying, oh, I'm a part of this, and I can relax, and I don't have to be tight all the time. And so that's the main benefit of that pelvic tilt. There's other uses for it too, but right now we're just trying to get muscles to turn on and shut off. And so primarily focusing on those abdominals is going to achieve that. The other thing too is, again, getting those muscles to lengthen and shorten. And there's different ways to do this. We're going to start with just a simple knee to chest stretch. So if you want to grab around the knee there, and as you pull that up, you can bring that knee just a little bit towards that same side shoulder and pull that down. That's going to bring that pelvis back, and it's going to allow those low back muscles to lengthen. And so once you get it there, I like doing some small circles, and it just kind of helps you relax those low back muscles. You want to visualize your low back melting into the carpet as you're doing this. And after about 30 seconds or so, we can switch, and we're probably about there if you want to do the other side too. And actually I'll have you keep the other knee up too as you do it. That way that pelvis kind of stays back, and it's easier to let that low back melt down into the table there. Again, make sure these are not painful as you're doing them. If you do get pain, just stop, or you can lessen the amount of the stretch there. The other thing I like doing, we've got a lot of rotators in our back, and so we're going to do a little bit of rotation side to side. And so if you bring your feet together, and we're just going to slowly go side to side. I also like tightening the abdominals if you can while you're doing this, because that gives you a little bit of support, and it's going to take a little bit of stress off of those low back muscles to do the exercise. So as he keeps those tight, he's just letting the legs go back and forth. Now some of his low back muscles are lengthening and some are shortening. And so we want to get that coordination better so that his brain realizes, oh, this is a muscle lengthening and this is a muscle shortening, rather than having to be tight and shortened all the time. So it almost becomes a mind over matter thing with the low back, because that pain has been reinforced for so long that now your brain can tell those muscles to shut down a little bit, and we can start that process in a different direction. Again, start with those. We're going to dive deeper into this topic, but I wanted to give you something to start with and have some success with. So let me know how it goes.